Hey, everybody. Welcome back to the TPA podcast here at Good Cop 2.0. I'm Maria Papaioannoy, and today, actually, for this interview, we have a friend of mine and fellow Canadian, Dr. Mark Tyndall. He is an infectious diseases and public health doctor. Did I get all that right?
That's right.
Oh, my goodness. And author of the book titled
Vaping, Behind the Smoke and Fears.
Behind the Smoke and Fears. I like that. So in the link below, we're going to pop in the link where you can buy Dr. Tyndall's book. We'll have that in the description for YouTube. But Dr. Tyndall, what do you think of Good Cop? Like, this is your first day. You've finished most of it. What do you think? What is your feedback or your thoughts?
I'm happy to be here. I'm with people that I've either know in this area or that I've heard about and met. So there's quite a intimate gathering of experts. So it's been just nice socially to talk to people about it. And the panels that I've heard so far have been engaging, and happy to be here.
I feel that like a lot of people are pulling you in saying, and then Dr. Tyndall, he knows about hard drugs.
Well, that's my, I guess that's my superpower, that I've had a lot of experience in harm reduction in other areas. Mm-hmm. And I've come rather late to the field of tobacco. I have a lot of experience. I know opposition to harm reduction in general. And I guess I have some insights into how things are going so terribly wrong with safer nicotine products.
Well, they are going terribly wrong. You know firsthand of what's going on in Canada. You can see it. But you've also lived in other parts of the world. Writing this book, you were outside of Canada. Was that not correct?
Yeah. So I lived in Bali, Indonesia for 2 years. So the smoking capital of the world, basically. And I had planned to write my book before I went to Bali, but little did I know that I'd be sitting in a place where 75% of men smoke cigarettes. So I was totally surrounded by that for 2 years. I also previously lived in Nairobi, Kenya, so another place where actually smoking is on the increase. And so it's been quite interesting seeing other populations involved with smoking.
That's interesting with Nairobi because they are heavily influenced by WHO and policies.
Yes.
Especially in tobacco.
Yeah, I was just there in the summer. I mean, when I lived there previously in the 1990s, there was probably more poverty, and cigarettes were out of the reach of most. But just, there isn't really good recent statistics, but just my observation, there is more smoking going on and very little vaping. And the people that I spoke to there were aghast that anybody would vape. So I did at one of the hospitals, I was involved in a debate about vaping, and out of like 40 healthcare workers, mostly doctors there, 95% at the beginning of the debate had a really bad impression of vaping and any safer nicotine products. And I think I convinced a few of them to change sides. But the message from WHO and whatever misinformation's been put out there about these products was deeply ingrained in the medical community in Kenya already.
Well, I think that's amazing that they brought you in to talk with them and debate them. That's like an oddity in this space, I find.
Well, I have a few old friends there, and
okay.
one of them is a guy named Frank Njenga, who's a very reputable psychiatrist in Kenya. He's a friend of mine that I've kept in touch with over the years, and he arranged it.
Well, I did see on Twitter some of the anti-smoking folks were just mortified that you were speaking in their country. Like, they were coming out hard.
Yeah, I mean, I think I left on good terms with most people.
I'm sure you did. But again, there's a different world with the social media and the real world.
Right.
I think for me, I went for a walk last night, and what I noticed here in Geneva was how many cigarette butts are on the ground.
Yeah, I think right around our hotel, and I walked from here down the, a few blocks toward the lake, and there was a lot of people smoking, and a lot of people with discarded butts. I mean, it was quite a contrast to having lived in Canada, where smoking rates are relatively low, and people are relatively careful about discarding butts. Whereas in Bali, basically, you could be ankle deep in butts on the sidewalk.
Yeah.
It's really quite incredible.
Even here in Geneva, guys, like I was surprised the smoking rates in this country.
Yeah.
I mean, maybe we need to, I'm not here to shame people who smoke. If you smoke, you smoke. If you're not able to make an informed decision with facts, and I feel like this is what FCTC and WHO is trying to do, is take away the truth, take away the science that doesn't agree with their position.
Yeah. Well, you and I both know that if somebody is smoking cigarettes and they get the correct information, that they know this is, 95% safer, that you can get flavors, that your clothes won't smell bad, that you don't have to smoke the whole thing at once. I mean, as a consumer product, there's so many advantages to it. And, I understand that people who've smoked a long time find any change and transition difficult. And there's probably people out there who would never accept anything but combustible cigarettes. But the majority, with the right information and a good chance to try different products, will transition.
Yeah.
And,
choice is so important. The different flavors, the strengths, the device. There's so much more added to it. And like, it's not that easy. It's not like you take, maybe that's why the NRTs don't work. You don't have choice.
Yeah. And my experience with people who have started vaping, still many of them are always doubting themselves whether they're doing the right thing. And at least as you and I know in Canada, the dirty looks people get from vaping are about the same as or worse than with a cigarette. So, there's people are still living in an environment where most people fear them and fear people who are vaping and don't like them for vaping. So it's we really have a lot of work to do to change the stigma around the use of these products.
No, absolutely. One of the things that you have done in your lifetime, you've done many things, but is also access to harm reduction, safe sites, safer supply, and fighting to ensure that it is upheld with our charter. Now, you're looking at the World Health Organization that wants to is advocating to remove tobacco harm reduction from the parties, the people involved. How does that make you feel if Health Canada doesn't stand up for tobacco harm reduction at this conference? I feel that it's ingrained into the being of who we are. Not necessarily tobacco harm reduction, but harm reduction.
Well, some of the conversations, even today at our meeting, I mean, it's as if these new products were just as dangerous as cigarettes, the way we're even talking about them. Mm-hmm. And so it seems pretty ridiculous that we're putting up barriers to a far safer product for people. And I think everybody in public health, no matter where you stand on harm reduction, have an interest in seeing the reduction of combustible cigarettes in the populations. And to me, it just really it makes no sense that you're putting up obstacles to people who actually would be accessing a much safer product that would make them feel better and benefit society in general. Like if we could get rid of combustible cigarettes, it would help our healthcare system. It would reduce secondhand smoke exposure. It would do so much for our society in general. And then, as you mentioned, it's really a human right. Like if you choose to use this product, nicotine, you should have access to it, and you should have access to the safest form you can get. And to come up with reasons why you're not allowed to get this, or to make it very difficult for you to access it and heavily taxing it, it just to me does not make any sense.
Yeah, and making it illegal to say the word tobacco harm reduction, like taking out, creating shame and stigma on a concept that works.
Yeah. Well, when you refer to other harm reduction I've been involved in, there's a lot of opposition to it. But it still was, I was always treated like, I don't agree with what you're doing, but, you're trying something and, good for you kind of thing. But now I'm talking about, promoting safer nicotine. It's not that I have a different opinion. It's that I'm an evil person, that I'm hurting children, that I'm hurting society, that I'm only interested in tobacco companies. I mean, the whole the pushback has been far different than me advocating for safer opioids.
Which blows my mind away. It does, because I feel that safer nicotine products is the one thing, and the people that are against it is the one thing that brings together the left and the right beautifully. So when we talk about political polarization on the other end, it brings together both sides, because you're either for it or against it. You just don't have an opinion on tobacco harm reduction. Yeah. And I find it fascinating. I always say this to some of the more, right-leaning media that won't do anything on vaping or nicotine. I always say, you know what? You and the CBC have one thing in common. Yeah. And that just, I'm like, hey, you both won't talk about vaping and tell the truth. Therefore, you both have that in common.
Yeah, the pure kind of libertarian type of approach should be that people should have access to these things.
Some libertarians still have clutching their pearls. Yeah. Maybe they borrowed it from the other guys. So what can we expect? What are you going to be? Do you remember or recall any of the panels you're going to be on this week?
Well, I think one's about scientific misinformation. Okay. And the other is kind of comparing different responses to harm reduction in general. Yeah. I think the panels I'll be.
Those are really good. Like the scientific misinformation. Is that it? Scientific.
Yeah. I mean, my background is a researcher. I spent 30 years in the university and published a lot of papers, and I got I have a PhD in biostatistics and epidemiology. I mean, I'm definitely trained as a scientist, and have used a lot of science to justify my support of harm reduction. But it becomes crystal clear that it's not research that's going to convince people otherwise. It's such an entrenched ideology that I think no amount of research is going to change some people's minds. And that's why, I like working with you and community groups, because the change is not going to occur because we have this ultimate paper in the New England Journal of Medicine that proves that, safer nicotine products are a good idea or that are very effective. It's really the consumer demand and saying that you deserve the right to use these products, and they should be accessible to far more people. And so I think that's where I prefer to put my energy, to try to, inform with the science, the community groups, and to individuals to get out there and start to demand access to products that could save their lives.
Oh, I know that Canadian consumers and consumers around the world really appreciate the work that you do. The book that you wrote, people are buying it. You can find it on Amazon. Just search Tyndall, Dr. Mark Tyndall. The book will pop up, and it's available on Amazon around the world too, right?
Yeah.
Is it being translated, or is it in English?
In English, yeah.
In English, okay.
But if anybody's listening and they're interested in translating it, then
reach out to Dr. Tyndall. Right. So thank you so much. I'm really looking forward to seeing you on those panels. Hopefully I'm not doing interviews at that time. And again, if you have one thing to say to the Health Canada delegation out there at COP, what would it be?
Come over to Good Cop.
Yes. Sonia and the team, they announced the team.
Oh, is that right? Okay.
There's Sonia, there's Tim, Les Hagen's here, Rob Cunningham, and Jeffrey Wong.
Okay.
So if any of you guys are there as delegates and you plan on listening to this, or if the WHO people are listening to this, we invite the Canadians here at the hotel. Just send us a message.
Yes. I mean, it seems like their WHO is trying to outpace them as far as their restrictions and their messaging. And even the Canadians, who we struggle to reform. So they might find a breath of fresh air over here.
Okay. Yeah, I'm sure Rob will love it. Okay, guys, thanks for listening to the Good Cop 2.0 podcast, and we will be back with another podcast very soon. Make sure you follow us on YouTube and on Twitter, Taxpayers Protection Alliance. You can find those links. Just search us. And if you're not watching the feed live, we'll have the link in the description. So make it a good one.